Good afternoon, ladies and gentlemen, respected dignitaries on the dais, distinguished guests, doctors, and my friends from the media. It's an absolute pleasure to be here today, being a part of this healthcare event. Thank you, Ms. Kaur, Dr. Vijay, Dr. Alok, Dr. Saifuddin, and the entire Apollo team, and the management for giving me the honor to be here today. The field of healthcare is deeply connected to society, and being a health and fitness enthusiast at personal level, I'm really thrilled to be among such a gathering. I'm sure whenever we think of healthcare or hospitals, one name that always pops up in our mind is none other than Apollo. And that's the leadership status and legacy Apollo has achieved today, with the decades of hard work, patient service, and commitment. Today, India is one of the front runners when it comes to quality healthcare, and our doctors are second to none. The whole world looks up to India for quality and cost-effective medical treatment. All this started with the vision of Dr. Pratap Reddy 40 years back. I'm sure Apollo will continue to lead the way, bringing many more innovations and shaping the future of healthcare in India and beyond. When we talk about innovation, I believe technology plays a very important role. AI is transforming healthcare system by enhancing treatment outcomes and improving overall patient experience. Technology has changed the way we live, and even healthcare is not untouched by it. If you are likely to develop a heart problem or maybe osteoarthritis in the next 10 years, you can get to know it today through some tests thanks to Apollo Pro Health. Imagine how easy, safe, and simplified our lives have become thanks to such advancement made by Apollo. Then in case of surgeries, I remember back in the day when an injury to the bone or joint, especially in sports or cricket, would bring a long and painful recovery, you would now have to undergo open surgery. It would take months before you could fully recover and return to the game. But now things have changed so much. The technology is advancing so rapidly. Although robotic surgery has been around for a while, I've heard so much about the benefits: high accuracy, minimal scars, and extreme fast recovery. But what makes this even more special today is the fact that Apollo Spectra is offering this advanced technology in a daycare, boutique-style, multi-specialty hospital setting. I believe this is the first, and it is a fantastic news for the people of Mumbai. It means quicker recoveries and fewer disruptions to people's daily life, which is what we exactly want. Spectra is a pioneer in daycare and short-stay surgeries, offering cutting-edge technology that helps patients recover faster. They have truly revolutionized the way people approach medical procedures, and it's no surprise that they are the best and fastest growing chain of hospitals in this niche area. As we witness the launch of this robotic knee replacement system today, I am truly excited to be here in the company of so many esteemed doctors to witness the milestone in the field of orthopedic surgery. It's a revolutionary step forward, not just for Apollo Spectra, but the healthcare industry as a whole. Thank you, doctors, who are doing an incredible job of bringing the highest level of comfort and care to the patients. For all that, I applaud you. It's been an honor to be here. Thank you very much. Thank you, and all the very best. Thank you.
Thank you. Yes. If you will now be part of that esteemed row of guests, and you will allow us a few questions. Ideally, I want to ask what exercise you do, but I'm bound to ask you medical-related questions today. So as you have self-admitted that you're a fitness enthusiast, clearly, what would you think is good medical advice for people who are fitness enthusiasts, especially when they're not in their 20s anymore? But you're probably teenagers now, you and your row of brothers. Yes. How do you do that?
So the first, can you hear me? Hello? Yeah. I think the most important thing is to be active in some form of exercise if possible. Sedentary lifestyle is probably the worst thing that you can do to your health. It's even worse. Yes. It's even worse than smoking or drinking or any abusive habit that you have. Because when you exercise, I think that's the time when, whether it's, flushing out toxins from the body or building muscle, because we now know that muscle is a longevity kind of organ, it's like it helps you live longer, because as you grow older, you need your muscles to get up, to do activity. So when you exercise, you're also helping your joint health and all of that. So any form of exercise, whether it is swimming, running, basketball, weight training, aerobics, or any kind of those, yoga for that matter, are very, very essential and important for mental and physical, benefits.
Great, and you mentioned something really important, which is joint health.
Yeah.
So how do you prevent joint injuries, especially if you are
Basically,
regularly
I mean to say,
exercising?
it's one has to be mindful about what kind of postures that you are in, even while you're exercising.
Correct.
Okay, so those are important. Warm up before any kind of an activity is important, because some people tend to, who are doing weight training, sometimes just hit the gym and they just get into a kind of a a workout which is probably they're not yet prepared, because I think the body still needs like maybe a 5-minute kind of stretching or something.
Correct.
Stretching is a very important thing. Stretching is also something that is very essential. So these are the few things, if you do, they will really keep away from, let's just say, a person who exercises and has a fall, and a person who doesn't exercise and have a fall. If you have muscles around you, you can protect your bones.
Right.
People who are stronger, if you like, let's just say the kind of acrobatic stuff that, say, a WWF guy does. He gets thrown and flung around and all of that happens. Why doesn't he get hurt?
Springs back up in a microsecond.
Why doesn't he get hurt as much as a normal guy? If he had just probably twisted his foot, what would happen to him? Is because you don't have the muscles to protect your bones, right? So I feel that muscles take away a lot of the injury shock. So the first
and
most
both
important...
the doctors are agreeing completely with what you're saying.
The first most important thing that you need to do is to build muscle, because that's your protective gear towards any injury that happens. People who have muscles will survive far greater injuries than people who don't have muscle.
Great, fantastic. So all this medical information that you are assuming
when I was very young, I was around 14, I met with a very serious Jeep accident, and I was flung from an open Jeep and I landed on my leg and I broke my femur.
At 15?
Yeah, I was about 14, 15 years old, and I had a horrible injury. Fortunately, I mean to say, it could have been even worse, because I landed on my leg, I could have landed on my head or whatever. And I had a mangled leg right in front of me, which had swollen to some God knows what size. So the accident happened at about 11:30 in the morning, but my first attendance that I got to the doctor was about 4:30 in the evening, because first we had to go to my family doctor, then he suggested what needs to be done. So I was in a taxi till then, and my first medical attention happened at about 4:30, and then the doctors, because I was young at that time, had decided whether they decide that I should be put, my leg had to be, the bones had to be screwed or to be put on traction. So I think that time it was Harkishan Das Hospital, and it was Dr. Bansal, if I could recollect. He was the one who kind of attended to me, and he probably took some time to say whether they should do those screws on my leg or to this.
Did you have screws in your leg?
No. So he took the decision for me to have traction. But it so happened is that when I healed, sometimes the bones don't join accurately. So I had a limp for almost a year and a half, because my leg had probably been a little shorter than, because of the injury, the joining. So I had, when the reason why I'm also very happy to be here, because of the orthopedic situations of injuries to the bones, is because I've undergone that scenario. And it had happened at an age where children play sports. So I used to play squash, and it was a high impact sport at that point in time. And because I broke my femur, I could not play those high impact sports for about a year, 2 years. And then it was never the same. So I could never recover to the what a normal fitness. I did everything. I played all the sports. I played squash again, I swam again, I played cricket, whatever. But I always knew that my left leg was never the same, because it's the strongest bone in the body, right?
Did you wish for some robotic surgery?
Like I said, had that situation, that's what I'm saying, maybe had that situation happened, maybe my recovery would have been faster, maybe my healing would have been as near normal as it should be. So technology has come a long way, and I think people of today are actually luckier and blessed that that this situation is there, and I applaud all the people who indulge in this kind of technology, that I wish them all the best, and doctors who perform these.
Doctors are sounding as excited as teenagers using this robotic surgery. It's lovely to see.
But I'm sure robotic surgery, but it's all assisted by them.
Of
it's
course.
It's all done by them. The robots are doing what they're being instructed to do.
Yeah, absolutely. Yes, absolutely.
Thank God.
But that's a lovely sharing. That's so lovely of you to share something so personal, but it's absolutely appropriate for today's launch event. How do you see the role of technology?
I think technology is something that is growing ever since now.
Yeah.
Like, it's in every field of our life, we are using technology for anything for that matter. So I guess
AI, robotics, it's all very
now
exciting.
how much of it is going to be misused? Because like everything is like, a knife is used for cutting fruits and also it can do some harm the other way.
Correct,
so
correct.
Everything is, whether the internet or any kind of social media for that matter,
Right.
if it's used in the right way,
Then it's very
very
advantageous.
good.
It's a good thing, yeah.
Similarly, if AI is used for detecting illnesses maybe weeks, months, years in advance, which is
Such a blessing.
it's
Such a
very good
blessing.
that you're more probable that you're going to get this kind of a disease or this kind of
Yeah.
something happen
That's
to you, and if you
fantastic.
could come to that conclusion, it's very good that you could prevent so many of those illnesses or situations which probably would
And prevent disaster.
Yeah.
Right.
last minute, which
Fantastic,
complication.
lovely. So lastly, about Apollo, I have some weird stories from my childhood. I used to wear an Apollo bandage just to look fancy because Apollo was a fancy hospital. Any stories you have? Apollo is today a leading name.
Yeah. So we always heard of this hospital because some of the very prominent people used to be admitted.
Exactly,
So
yeah.
it's like any kind of dignitary or any kind of statesman
Yeah,
would
Apollo was the name,
probably
trusted
had
name, yes.
severe heart attack or needed a very, very serious surgery. I mean, it's the only hospital that we used to hear about where they used to go or they used to want to go was
Yeah,
Apollo. So that's something that they've earned since ever, So that's a great name,
Yes,
Yeah.
that's right. All right. So I hope you and your family never need to use a hospital.
If that is the case, then probably Apollo is the place.
Apollo, right. Thank you for your time. Lovely conversing with you. All right, I believe the consulate from Oman, sir, you are here. Can we please felicitate you?
You are so right. You are so right.
Mr. Badr Wahebi. May I please invite Mr. Ashfaq Sheikh to felicitate Mr. Badr Wahebi, the consulate of Oman. Mr. Sheikh, if you will just do the honors, please. Good morning and thank you for being here this morning, sir. Lovely to have you here as one of our esteemed guests. I believe you have a few words to say to us, sir. If you will say a few words to us, will you? No? No? All right. Your presence is great. Thank you for being here. Have a great participation of the event. All right. Thank you. May I please now invite Dr. Safiuddin Nadwi to come and speak to us.